Hi Cam followers, this is Amy and I am joined by Kevin Parsons, who is just fabulous, and I remember him very fond memories from university. And so I just need to do some things that we have to do because we're volunteer led. So tonight we're really lucky to have Animal Care sponsoring this live. And they've been supporting owners of arthritic dogs in pain management for a number of years. So thank you very much to Animal Care for sponsoring this live. So on to the fun stuff. So tonight we are joined by Kevin Parsons. He works at, is it Langford Veterinary Services still? Is that what you call it?
Well, Langford Vets. We're a bit less of the services, more just Langford Vets.
Based at University of Bristol Vet School. And I'm going to pass on to Kevin so that he can introduce himself properly, and then we can go from there.
Okay, thanks, Amy. Thanks for the invite. It's nice to be here speaking to you tonight about arthritis and arthritis of the elbow. I guess Amy did say I need to introduce myself. I don't really go in for long introductions. I'm one of the orthopaedic clinicians at Langford. So I've been at Langford for 11 years now. I was at the Royal Veterinary College before that. And we see a wide and varied caseload of orthopaedic cases. Obviously, a lot of those are made up of cases affected by osteoarthritis. We perform probably 100 hip replacements a year at Langford. We see an awful lot of cases of elbow dysplasia. Unfortunately, one of my colleagues spoke about hip osteoarthritis maybe a year ago, I think, with Hannah. And that would be the talk or the discussion I'd rather do, because we'll
have you back. That's
we know an awful lot more about the hip, and we've got some good options for the hip. I.e., the hip replacement is a great option for hip arthritis. For the elbow, it's a much more challenging joint, and we rely an awful lot more on conservative treatment options. And classically, obviously, as an orthopaedic surgeon, I'm wanting to be doing orthopaedic surgery. But I think there's a lot of discussion about what surgery is the most appropriate for the elbow, and there's really very limited evidence for most of those surgical options. So if you're seeing someone who's saying this is what you have to do, it will get better, then I think we need to be a little bit skeptical with the elbow, because there really isn't there's a lot of opinion related to the elbow rather than good evidence.
And sort of when we're looking at elbows, do you want to sort of chat to everybody about how you stage elbow disease?
Yeah, exactly. So we're presented with cases, a wide range of cases. So we're presented often with, the middle-age dog that has the chronic grumbling lameness that's gradually getting worse, and they go to the vets, they have some x-rays, and they've got arthritis, and then they're referred to us for a scan, the magic word scan, because a scan will fix everything. Basically what the scan will do, if we do a CT scan, will really better characterize the level of arthritis in the elbow, and perhaps give us a steer as to what treatment options may be most appropriate. But with those end stage elbows, really, the very arthritic elbows, the conservative treatment is always going to be the mainstay of treatment. Okay, and I think we should. I think coming and thinking there's a magic surgical solution for those elbows is naive. Okay, so I guess how would I approach? Is that sort of what you're thinking, Amy? How would I approach?
How would you approach?
So let's say, as I say, a middle-aged Labrador, for example, or any breed dog with an arthritic elbow. First thing we want to do is get a really good history from the owner to find out what exercise that dog is having, what activities make it worse, whether there's been any environmental modifications in the house or in the dog's lifestyle that have aggravated the problem, what medication it's been receiving, how it's responded to those medications, And as I say, we just need to get a really good history to find out, the chronicity of the problem and the progression of the problem. Because we've got to remember that with arthritis, we often get flare-ups of arthritis, and it's very easy to come and see a vet quickly.
Yeah.
Us do something expensive and radical, and the dog get a little bit better from that, and I get the pat on the back for being the person that made that dog better. But actually, we know the natural progression of osteoarthritis waxes and wanes, and so often there isn't a need to make a rush decision with these cases. Often a period of conservative treatment, a good conservative treatment, with an appropriate physiotherapist or the alternative therapies and pain relief and things, then often these dogs will improve quite considerably without surgery. I always say to the owner when they come back, I wish I did surgery, because you would think I've made the difference. But actually, we have to remember that with really good conservative treatment, we can improve these cases. So yeah, so I'm probably rambling a bit. So basically, how would I approach it? Get the history. We do a thorough physical exam, check for any other problems, because there are other problems. We really need to make sure there's not an infection in the joint. We've got to remember that arthritis doesn't usually cause dramatic changes. So if there's a sudden change, that's when we need to be looking for another problem. So if there's a sudden worsening of that lameness, if a dog's got arthritis and it's suddenly 10/10 lame and not putting its foot down, then we need to be looking for something else. Has it fractured something? Has it got a septic, an infection in the joint? Is there something else? So we do some tests often to rule that in and out, and that often is what the scan is for. And then MRIs and things aren't really worthwhile for arthritis. We might do an MRI if we're looking for a neurological problem that could be causing the worsening of the lameness, but for the arthritis itself, it's really X-rays and CT are the key. And then in most cases, as I say, I think a period of conservative treatment is often worthwhile before rushing in and doing anything dramatic with surgery. Because if that joint is full of arthritis, I think we're kidding ourselves if that we think there's something we can do to make a really big difference. So
moving on from there, because we're sort of talking about sort of a middle-aged dog that's possibly had elbow issues for a while and unfortunately developed osteoarthritis in that joint as a result of potentially elbow dysplasia. But when you look at the elbows, there's a grading structure that you follow, isn't there?
I guess in terms of grading of the severity, there are different schemes for grading arthritis. But again, another thing that I always say to an owner, because often owners, often I'll say to an owner, so why are you here? And they'll say, well, because we had x-rays and they showed the dog has arthritis, but the dog isn't lame, or the dog is only mildly lame. And so to me, a lot of the grading systems are useful, but I think it's really important to read the dog, not the x-rays. Okay, so I go very much, personally, I go more clinically how the dog is doing than what the grade of the arthritis is, or yes, we can stage arthritis, to being non-responsive through to being very, just slight discomfort. There's different grading systems, and there's loads of information about that on the CAM website, and in orthopaedic forums. But ultimately, like I say, I try and read the dog, not the x-rays, and that's what I base my decision making on. So again, if I've got marked arthritis but the dog really isn't very painful or lame clinically, then again, I'm not going to be doing anything, in most cases, dramatic in an older dog, because we just need to manage the clinical signs. Okay.
And do you ever see sort of younger dogs that are displaying sort of signs of pain, and then you find out they've got sort of elbow dysplasia?
Yeah, so that's the other group of dogs that we see. Okay, so and I guess thinking about those older dogs, just to finish or move on with those older dogs first. No, that's fine. If conservative treatment doesn't work, and by conservative treatment, what am I talking about? Well, I'm talking about exercise modification, weight control. So weight is, the most important, I think, probably one of the most important things. Anti-inflammatory medication, so non-steroidal anti-inflammatories, so meloxicam, carprofen, all the options that we've got available there. We've got other pain relief medications that we can introduce, paracetamol, tramadol. We've got new products, Librela, which again is there's lots of new treatments, and then there's the physiotherapy and all those. So if I've tried that for a period of time, and it's not responded, then there are surgical options, and I think that's when definitely I will reach for surgical options. Ultimately, like I say, I'm here to do surgery, and I usually get someone else to deal with all those conservative things that I've talked about. I sort of refer on to a sports medicine person or a veterinary physiotherapist to work on that. The surgical solutions that are reported and that different surgeons have their preferences, osteotomy procedures where we can cut bone and alter the loading within the joint. So there's an operation called a PAUL, which is a proximal abducting ulnar osteotomy. There's an SHO, a sliding humeral osteotomy. There's a proximal ulnar osteotomy. So there's different osteotomies. Again, if you pull out the few papers that are published on them, the results are quite variable. So some dogs do well, some dogs don't do well, some dogs do terribly. And so again, because it's not, because to me, there isn't the evidence that 80%, like a hip replacement, you expect 95% of dogs to do really well after that. With these osteotomies, generally 50% do really well, 50% do okay, and not quite 50, and a few don't do well. So such a mixed outcome from them that I'm always reserving those for the dogs that haven't responded to conservative treatment, having of course ruled out things like an infected joint or a fracture or something, because obviously that is a different thing to just arthritis. So there's osteotomies, and then there's joint replacements. And so joint replacements of the elbow are tricky, and there's been systems that have come and systems that have gone. The number of elbow replacements in dogs, there was a flurry of different systems probably 5-6 years ago that, again, 40% of the dogs did terribly, 40% of the dogs did okay. So again, it's still not like the hip replacement. And if you're going down the line of a joint replacement for the elbow, I think you really need to be confident that there is no other choice personally before you try that, because the if it goes wrong, it's either amputation or euthanasia or potentially arthrodesis, which again isn't ideal. So again, it's very different to the hip and very frustrating, and I just wish I knew what the right thing to do was. As I get more and more experienced, or maybe older, I do less and less of these surgical options, because I just think with good unless a conservative treatment is the outcomes, again, some do well, some don't do well, but if it doesn't do well, it's not a disaster. Whereas with some of these surgeries, if it doesn't do well, it's a disaster. But if nothing else is stuck, then you have to try. So that's the old dogs. Coming back to the young dogs, then yes, we see lots of dogs. So we either see dogs that are old with lots of arthritis, or dogs that are young with early elbow dysplasia. And so then I think there are potentially more options that are more worthwhile from a surgical point of view. So we would again examine the dog, get the history, rule out other diseases like panosteitis, which is inflammation within the bone, and other conditions that can affect young growing dogs, and get a CT. Okay, and the CT will really tell us quite well whether there's elbow dysplasia. But then, most Labrador elbows, for example, have a degree of dysplasia. If you look, what is normal, and often, and I don't know, how, if people here have had young dogs where there's a fragment. We see fragments of bone within the elbow, so we call it a fragmented coronary process. And traditionally, people have advocated rushing in and removing those fragments arthroscopically. Again, I struggle to go in and remove a fragment from an elbow of a dog if it's not lame.
Mm.
When I'm examining it, I only want to operate really on lame dogs. And I see lots of dogs that are 5 years old that have got arthritis and a fragment that's in there that have not been lame for 5 years, despite having that fragment in there. So I don't think there's a good correlation between whether there's a fragment and whether a dog's lame. And there was a study from quite a few years ago where they took a group of dogs and removed the fragment from half of them, didn't do anything in the other half, and a year down the line there was no difference between the two groups. So again, people who are confidently saying you have to rush in and remove the choroidal fragment, I just don't know if that evidence is there. But again, if the dog doesn't respond to conservative treatment, then I think 6 weeks of physio, some pain relief, it's still lame intermittently, and there's a big fragment. Yes, I think then you've got a reason to potentially go ahead with arthroscopy and remove the fragment and assess the cartilage within the joint and decide what's going to be appropriate. So the other thing in young dogs that we look at is there any joint incongruence? So do the bones line up? So the elbow is made up of 3 bones. They need to sit together really well. And if there's any steps, because bones are slightly different lengths, then we can do osteotomies, which is where we cut the bone to try and improve the structure of the elbow. And there's a theory that, and it seems reasonable, that if there's a step in the joint, then that can't be great for that joint. And if we can improve it in a young dog, then maybe we can slow down the development of arthritis in the future.
Absolutely.
Okay, so young dogs different. Again, there's lots of osteotomies in young dogs that we can do, which sometimes we do to unload things, load different areas of the joint to improve congruence. But my personal approach is, if there's not a big incongruence on the CT and a dog isn't lame, but just has had an intermittent lameness, because usually we've got a bit of a waiting list. So, the dog might have been lame at 7, 8 months of old. It comes to see us at 9, 10, and it's not been lame for the last 4 weeks. But I think personally, I don't want to take a not lame dog and make it lame, because if it's lame after my surgery, then an owner will blame me for it being lame, despite the fact it's probably the progression of the disease. So tricky elbows.
Yeah, they are. They're like one of probably the most tricky joint.
Yeah. We often call it a shelbow lameness as well, because is it the shoulder or is it the elbow?
Yeah.
And we need to differentiate.
That's a whole other point, isn't it? Yeah. And do you do quite a lot of arthroscopies in young dogs? Because I've got Jenny and Janet who've both got one's got an 8-month-old dog and the other one's got a 2-year-old lab. Both have had arthroscopy on their. Both have had arthroscopy. One's had arthroscopy in front legs. So
personally, again, I would do arthroscopy on a dog if it's got a persistent. If on CT, there's a reason to do the arthroscopy. So if it's got, for example, a dog's got osteochondrosis on a CT, that leaves a little flap of cartilage. And so if you remove that flap, it should make the dog a bit more comfortable. Might not change the progression of the arthritis, but it might make it more comfortable. And so there's a clear indication for doing it. If there's a fragmented coronoid and a dog doesn't respond to conservative treatment or is persistently lame, then yes, I would do arthroscopy. I struggle with a dog that comes in that isn't lame when I examine it and doesn't have really obvious changes on CT to justify the spending the money at that time on arthroscopy. And as you probably know, in the NHS, arthroscopy is becoming less and less used because it is a useful tool for looking in the joint, but just the cost benefits of it in a dog that's not lame, I don't know if it's there. If a dog's, as I say, if it's persistently lame and we need to do something, then yes, I think arthroscopy is good. In the older dog, again, I didn't really talk about arthroscopy in an older dog with arthritis. I have had dogs where, again, they've not responded to conservative treatment and physio for 6 weeks. I go in with arthroscopy, give the joint a good flush out all those inflammatory mediators that are part of arthritis, and potentially remove any loose fragments of bone, and the dogs have improved. For sure, but how permanent that improvement is hard to know. Would it have improved anyway? Well, we don't know. I'll take credit for the improvement, obviously. And you know, will it 6 months down the line it be any better than if I didn't do that? Who knows? But as I said, if nothing else is, if other things aren't working, then I think yes, it's worth doing. And I definitely have, you know, I've got some owners who have been delighted with the results of the arthroscopy, and obviously I'm delighted. But I was chatting to someone earlier saying I was coming to talk about elbows and how hard it is to talk about elbows, and they were telling me about how if people spend a lot of money, the psychology of that has been shown to be that people are happier with the outcome. A bit like if you buy, I don't buy expensive makeup, but if I did buy expensive makeup, you feel like you look better because you've got that expensive makeup on, apparently. Or if you wear expensive perfume, or then so people who spend people spend a lot of money, they want to see the positives of it. But I don't know. Sometimes I think there's a reasonable number of arthroscopies where I don't know whether there is a massive benefit. And that's not saying it's the wrong thing to do, because without doubt, looking in the joint and being able to say to an owner, look at these photos, the cartilage is all gone. Here's the reason why your dog is lame. It helps an owner understand. It really helps an owner understand, and it helps us better give a prognosis of why this dog is recurrently lame. Because if I'm just saying your dog's lame, it's got arthritis, and there's a chance that doing arthroscopy will make it better, and I'll give you more information, then I think that in itself can be worthwhile to a lot of owners. It's just not going to be a magic solution.
Yeah.
Does that answer their questions? Again,
Yeah.
the elbow.
I
always feel like I ramble about the elbow, because I can't say to you there's 10 scientific papers that demonstrated in a 2-year-old dog that doing arthroscopy makes them better. There just isn't that information, whereas we could for the hip, or we could for other operations that we do.
Yeah. So it's one of those, isn't it? And sort of my next point on our agenda is we've talked a bit about sort of the young dog and the old dog, and we've talked about some of the surgical options, and we've talked about sort of very loosely conservative management, which we'll delve deeper into in a bit. But do you have sort of any experience, or have you used any sort of intra-articular approaches to the elbow?
Yeah. So in terms of intra-articular approaches, then what we have, I guess traditionally we have steroids, which would be used in people quite a lot for painful joints. Working in a university teaching hospital, we're always very reluctant to use steroids. But I think just because of the potential side effects of them.
Yeah, I guess.
Once you start putting steroids in, yes, I think I occasionally use a one-off steroid injection to reduce inflammation, and it will definitely make an animal more comfortable. But if you're having to repeat it, which you will have to, then you get more and more cartilage damage as well as the benefit. So probably the cons outweigh the pros of it, and also there's an increased risk of infection within the joint once you give steroids. But I still know, very experienced colleagues who, again, are sort of on the same page as me of not doing as much arthroscopy as they used to, and put steroids into these young dogs, and as a one-off, they go home, it settles things down, and then there's been an improvement, and that's great. But again, was it going to improve anyway? How long does the improvement last? Who knows? So steroids tend not to use, but I think there's definitely a place for them. And I would have that conversation if I have a dog that is persistently lame, we can't really seem to improve, then it's worth a try. Then there's some other intra-articular things. I guess the thing you're thinking about more is platelet-rich plasma, PRP, and stem cells. So it seems that some people report really good outcomes with those therapies. I've not personally seen such good outcomes, so maybe I'm not doing it right. Maybe my outcome measures are slightly different. I think the thing that, again, you have to be really careful with these things is what happens is someone comes in, their dog's got arthritis, and people throw everything at them. So
concoction of everything.
Let's do rest. Let's do physiotherapy. Let's start non-steroidals and possibly some other oral pain relief. Let's restrict the walks and stop playing ball, and we'll inject some PRP in the joint. Oh, my dog's better. The PRP is amazing. But actually, what is amazing, it could be any of those. And yes, great, if the PRP has made a difference, fantastic. But personally, I prefer changing one thing at a time, so what sticks. But that takes time and patience and can be frustrating with an owner. And actually, with an owner, you want to have a result. But again, the evidence for PRP is mixed, I think. And I think our experience is yes, if there is a benefit, it's quite short-lived, and it needs to be repeated, and that can get quite expensive.
Yeah.
And probably I personally, if it were my dog, I would spend that money on a good physiotherapist, doing range of motion exercises and some other therapies potentially, before spending a lot on PRP. But I get it. It's frustrating, and if PRP in the mix does make a tiny difference, that as I say, in my hands though, I don't. And again, we're more of a surgical department, and so anything that I would want to have therapies like that, I would refer to our pain clinic, and the pain clinic would work with the physio and tailor things. And as I said, the pain clinic's experience is at the moment they're not really using those intra-articular particularly PRP at the moment, because they hadn't seen the results. Saying that, we've got a new PRP system in, and I tried it on a dog recently. But at the same time, I did do arthroscopy, and the dog is now being rested, and it's getting better. How much of that is the PRP? I have no idea.
Yeah, it's really difficult to measure, isn't it?
Yeah, and what we need is some good like mass controls, blinded control studies that will pick out the difference. But people, they're just hard to perform, and it's just not there.
Yeah,
the other intra-articular thing, and again, because I tend not to use them but refer them across to our pain clinic, is there's some intra-articular sort of hydrocolloids.
Yeah.
I know that we had some good results with those, but I think it was taken off the market recently, or it's been hard to get hold of. But I don't know. I don't know. As I say, one of my colleagues tends to use that. So I think there's a place again for these treatments, but start with the simple things. Start with the rest, and then building up the activity, the anti-inflammatories, the maybe supplements might add, especially omega-3 fatty acids and things. Then if that doesn't work, you put in something else, start physio and hydro. And if that doesn't work, you add in something else, rather than just spending everything quickly and not knowing what's making the difference. And remember, as I said, the clinical signs wax and wane anyway, and you will have good spells and bad spells. And if your treatment or therapy starts with the onset of a naturally occurring good spell, then we'll think the treatment's what made the difference, rather than actually the waxing and waning of the clinical signs is making the difference.
Yeah, definitely.
I sound terribly cynical.
I think it's a difficult one, isn't it? Because what's really, really helpful is that it's a really sort of realistic, down-to-earth approach, and it's something that is really accessible to a lot of our owners. And it's really nice to hear sort of we're not advising some super fancy brand new surgery.
No, I wish I was.
Yeah, I mean, that would have been a nicer and easier option, wouldn't it? But
exactly. And as I said, in some people's hands, sliding humeral osteotomies have been shown to have a really good outcome. But then I know lots of other people who have done them and have had really not good outcomes. Similar to Paul's, there was a recent publication of the proximal abducting ulnar osteotomy recently that showed no difference between the dogs that had it and those that just had arthroscopy. But then the other people who swear by the technique say there was a problem with the methodology of how they were doing the technique. They weren't doing it quite right. And so there's just so but if these people aren't trying new things, then we won't progress, I guess.
Yeah.
But what we really need to do is everyone needs to work together and really critically evaluate. But you can never have a control dog the same, and as I say, we always
Yeah.
rest them after surgery. We always introduce different medications anyway. So is it the medication surgery? I don't know. But as I say, I'm very happy to do these surgeries, but I don't want to do them personally. I don't just take every dog that comes in and have the recipe that middle-age arthritic dog, Paul, middle-age young dog, arthroscopy and remove the coronoid. I don't do that because I think
Yeah.
each dog is an individual, each owner is individual, and I want owners to be aware really, and probably really be aware that whatever happens, this is a lifestyle management thing that's going to, no matter what we do for the rest of this dog's life, you're going to have to be doing these conservative things as well. And so you might as well start those at the start and see if they work first.
Yeah, I think you've hit the nail on the head there with it. It largely is.
Yeah,
Especially
it's going to be the mainstay. Yeah.
The mainstay is. Yeah,
and it's hard. I
changes
think I've found as well over the years that it's harder not doing surgery than it is doing surgery, because once you've done a surgery, owners are happy in a way. Often happy that we've done everything we could. We've done the operation.
Yeah. It's almost a bit of closure, isn't it? It's like I've done everything.
You've closed it.
Yeah.
They've spent the money that's available to spend on that, and we've done everything we could. Oh well, that's where we are now.
Mm.
And one of my good friends in the village, their dog has probably had one of the worst elbows that I've seen with osteochondrosis at 7 months of age. Terrible flaps of cartilage, and I did remove those flaps, but I kept thinking, I spoke to different colleagues, and I was being told you should, one person said, "Oh, you should definitely do a Q, which is a canine unicompartmental elbow, where you replace a little bit of the elbow." Someone else said, "Oh, you should definitely do a pawl on that." I didn't do any of those things, and that dog is now 7 years old and intermittently has flare-ups, but has hydro and physio during those flare-ups, but otherwise is leading a very normal life. Whereas if I'd done one of those operations, I would have been delighted with the outcome as it is now. I'd have been really pleased and think I'd made a big difference to that dog. But nobody would have known. And if it was lame now, well, it had the operation. We'd done everything we could have done. But then another case might be different. There's other cases where we see them, they're persistently lame. You try all the conservative treatments and you do a pawl on them, and they're great. They've improved significantly. Yeah. So it's just, you sort of almost need a dice to decide the treatment.
Yeah, but I mean, your point about sort of treating every animal, every dog as an individual, and every owner as an individual, I think that's such an important point, because, we've all, as vets, we've all seen dogs that have fairly mild signs on the outside, but when you take an X-ray, it looks shocking. And then vice versa, where you've got someone who, a dog who's got actually really quite significant signs that they look really uncomfortable, but then when you take an X-ray, you just think, is that it? Is that really what can be causing all of this? So it's really tricky, and I guess that harks back to loads of different things in, pain thresholds, muscle tension, how have they compensated as an individual, all of that.
Definitely.
So, is there anything else that we need to talk about? Oh, someone's just asked about laser. Have you found we've talked about
so that's an interesting one. And I actually spoke to the pain clinic about laser today, because I thought someone might ask about laser.
I love it.
Because again, if it's I go through all what I've talked about this evening with an owner, and then I say I want you to go and see the pain clinic or a sports medicine person or a physiotherapist to discuss the other things. I think there's clearly evidence in the human literature that as long as you're using a class 3 or 4 laser, that there are anti-inflammatory benefits to it. But speaking again to the pain clinic team today, they are very much like it has to be done regularly enough. You have to have the right type of laser. So apparently, and again, this is secondhand. This isn't my knowledge. I don't want to take credit for this. If in any reasonable sized dog, really, that needs to be a class 4 laser to get adequate penetration. You probably know that more than me, Amy. And also my thought about laser and all of these treatments are it needs to be done as part of a program being done by a person who is thinking about what they're doing and thinking about how that fits in with the other therapies that are being done. So personally, do I think turning up once every 2 weeks for someone who may have been on a laser course but isn't thinking about the whole picture, where are we trying to go with this, standing there with a laser for 20 minutes and then taking it off, I don't know if that is the right way. I've had dogs in the past where I've done TPLO on, and I recommend hydrotherapy quite often if I'm concerned and want to build muscle up, and Nona comes back and say, oh, we decided not to, someone told us not to do hydrotherapy, we just go in once a week and have the laser on the leg. Well, personally, I think using the leg is bound to be better than, and so if there's a pot of money to spend, you don't want to just spend it. You want to make sure that you're getting good use out of that pot of money, and save some money, because again, you may be ending up having surgery, and if you've spent it all on little things that are tinkering around the edge, just where actually just giving non-steroidals might have been enough with some physio, then if the physio feels it's going to be a benefit and they're a chartered physiotherapist or a vet sport medicine person, then I think you just need to be careful, that you're doing it as part of a tailored program for that pet.
Yeah, and at CAM we're always banging on about the multimodal approach.
Yeah,
it's so important.
So multimodal is really important. But I do think multimodal, but introducing things in sequentially, not just here's £2,000. I'm going to spend all of that on all these things, when in fact it may not have needed all of those things. It's like a puzzle. You just need to put the bits in the puzzle bit by bit. Some things will stick. If it doesn't work, you can take it out and put something else in.
But again, then with the staged approach, I don't know where you usually start, but do you want to just discuss sort of where you usually start? Because we kind of tend to look at the evidence base behind things, don't we? So we wouldn't normally pick, for example, one of the more controversial things like PRP, for example, as a starting point, would we?
Yeah. So I would start with initially, analgesia. So the licensed analgesias are the non-steroidals, and exercise modification. But again, none of these dogs, it's not the right thing to stop them doing anything at all, because they need to be moving and so it's controlled exercise. So I'd say, if a dog's had a flare up and is quite lame, I'd say, room rest it, walk it for 5 to 10 minutes, 3 to 4 times a day on a short lead. If it's tolerating it and it's not getting worse, then you can increase the length of the walks by 5 minutes per walk per week. And if walking a dog for an hour on the lead twice a day isn't making it lame and more sore, then do that. But if playing ball for 5 minutes makes it sore, then don't play ball. If you can walk it for 2 hours off the lead, but running up the mountain on a Saturday makes it sore, well, don't do that. Keep the exercise regular. And I think people with their dogs are really good at not. I don't ever want, when dogs aren't humans, but equally, if I do 6 hours of walking at a weekend and nothing in the week, well, I'm going to be sore. And so you just want to keep it regular. So non-steroidals would be my first line, with exercise modification, obviously weight control if that needs doing. Then physio would be my next. Well, joint supplements. I always advocate joint supplements. Again, you aren't going to get a magic solution with joint supplements. Usually they're started with non-steroidals, often,
Yeah.
but I think the joint supplements that have the most evidence would be omega-3 fatty acids.
Yeah.
But you need to be careful with the joint diets because they're also quite high in energy. So you can be making a dog fat whilst giving it omega-3. So you need to be careful with that.
I keep telling my mum that she's got a dog on joint. I've put him on joint food and he's got fat, and I'm like, Mum, you haven't been weighing it.
Yep. Exactly. And then there's a cheaper way of giving omega-3 fatty acids with olive oil.
Yeah.
There's then there's the Cartrophen injections and things like that, again, which we don't really use at work because we're a referral hospital, so we don't see these animals back regularly for their weekly or monthly injections. So supplements, I'd usually say, one of the supplements, but always use a veterinary supplement because of the absorption of them. Then I would, after that, start to think, and the laser and the intra-articular things, as I say, I tend to leave that for the physio to sort because they aren't my first line of treatment at all. So yeah, I think that would be that was the question, wasn't it?
Yeah.
That would be typically how I'd approach the sort of older dog with, or any dog really with joint pain.
And how much time would you sort of give a staged approach before you started thinking about some surgical?
Yeah, so if it comes and it's been persistently lame and they've done a reasonable job at conservative treatment until then I'm very happy to go ahead with arthroscopy and see whether there's going to be a procedure that we might consider. If they come and they're not particularly lame, or they really haven't tried conservative treatment, then I usually give about 8 to 10 weeks. I say, give me a phone call in 8 to 10 weeks, and if there's no improvement, then we'll consider doing the next thing. But I usually do want that to be under the supervision of a physio, just to know it's been done properly. If it suddenly gets worse, or an owner changes their mind and goes home and thinks, actually, I just want to get arthroscopy done, because there is definitely a place to say, I just want to get all the tests and everything done now, so that I know it's done, as we said earlier, and then I can start the physio. The physio will know what they're working with. We aren't sort of shall we, shan't we kind of thing. So I'm not averse. If an owner's like, look, I'd rather just do that now because I want to get that part done, then I think that's fine. I do struggle to do it in a dog that's not lame though.
Yeah.
Because I just don't want to make a dog lame. There's nothing worse than taking a dog that's not very lame and it being more lame.
Yeah. Pretty soul destroying, I bet. So I think we should end in our top 10 tips, which Hannah is.
Oh my gosh.
Loves the top 10 tips.
And I did remember, and I meant to talk to you about this before, that I hadn't written down top 10 tips.
That's okay.
I guess some of them can be 1, 2, and 3, like education. So that could be no. My top 10 tips would be, I should say, select the right dog in the first place. No, that's I would say, wait.
Yeah. I was trying to.
What are you going to say?
I was just getting your joke. I'm just a bit slow.
Yeah, okay. I would say weight control is the most important thing.
Weight control is.
Don't expect quick results.
Quick fix, yeah.
It's going to be a lifestyle management, lifestyle long-term management.
Yeah, and that's all of the things that we sort of mentioned on our CAM website, like rugs, loads of rugs, trying to reduce sort of slippery surfaces and things like that. You can have 2 there.
Yeah, exactly. Remember, things like anti-inflammatories and medications are available, and we don't want our patients to be in pain.
Yeah.
But also remember, this is a hard one. Always remember that what I often say to owners is, what is pain? You know, in that
so true.
when I stand up now, I'm in pain because, you know, I went for a run this morning or something. And so it's important I think it's really important to, as long as you're doing everything you can do, I think some dogs, no matter what you do, will still have an intermittent lameness. And as long as they're happy and eating and drinking and enjoying their life, I think that's important. So don't get bogged down by it. There's lots of people out there to help and give you advice, but you know, lots of dogs will have an ongoing lameness, and unfortunately, like people, sometimes you have to accept that. That isn't really a tip. That's sort of a I've got 5.
Yeah, we're getting there.
Don't believe there's a magic solution to elbow lameness. If anyone's saying they can definitely fix your dog, then be a little bit skeptical.
Yeah.
Follow up with your physio. You know, but also I think it's important to make sure you're getting good responses from these aren't very good tips at all. These
They are good tips. They are.
Always question, but not too much, because it's hard when you're being questioned lots. There's only so many hours in a day. But always think, am I getting a benefit for what I'm doing? And so if you're going to see someone and you've been going for a year and you're still going and still paying, then actually, are you still seeing the benefit, or have you learned enough that you can manage this? And then maybe in 6 months' time, go back for a reassessment, so you don't have to. Again, this isn't really a tip; it's more sort of advice. I'm worried Hannah's going to watch. I hope Hannah doesn't watch these.
Hannah
Sorry,
watches every single live.
Does she?
She'll give me feedback tomorrow.
Will she?
Yeah.
Oh my gosh. What am I on now?
You need 2 more.
Go on the CAM website, lots.
Yes.
Because there's lots of great information there.
Yeah.
And work closely with your vet as well.
Absolutely.
And yeah, you just have to be patient, you know, because, and as I say, it's a lifestyle thing. It's particularly for the elbow. And there are things, there's lots of us who want to help. But sometimes, no matter how hard we try, there isn't a magic solution.
Yeah, you're right. And it's frustrating, but, you know, all we can do is at our absolute best with what we've got available.
And we all know, there's lots of, as long as we're doing everything we can and the dog isn't, and we're doing everything to improve its quality of life that is available or within one's means. Okay. And that's another thing that's hard in my job, is sometimes things that we can offer aren't in people's means. And that's tough then. I don't want people to feel guilty about not doing something dramatic that may not offer, but because it's an option, they feel it should be. But as long as you're doing everything you can, there's lots of very happy older dogs out there with a little bit of limp waddling around who are very loved pets and enjoying their life. And we're doing what we can to make them as comfortable as we can.
Yeah, absolutely. And one last thing, someone's just mentioned massage therapy. Have you got any experience of massage therapy?
Again, I've not personally, because it usually fits into the alternative.
Yeah.
I think, again, if it's, as long as it's part of a program and it's being, the hard thing is there's such a placebo effect with all of these treatments that we just want to, you know, we all want to see the benefit, and we know that if we were to give owners a blank tablet and a placebo tablet and a pharmaceutical tablet, a reasonable proportion of those having the placebo treatment would think their dog's a lot better on it. And so I just think it's important to evaluate. And there are, patient assessment tools out there that you can get. And again, you can speak to your vet about these. And I think they're useful, because actually you can document, what's my pet like now? What's it like now it's having treatment? And then withdraw the treatment. What's it like once you withdraw the treatment?
Absolutely.
And see whether you're seeing, and that makes it a little bit more objective. They're not totally foolproof, but you just want to be you don't want to be sort of swept along with the positivity that we're trying to give you, because obviously we want things to go well as well. You need to try and be objective, because you just want to make sure that what you're doing is of benefit to your pet, is worthwhile financially for you. Because, as you know, I just hate people wasting money on things that aren't making a difference. It's better to save that money for, you know, things that we know that are definitely working.
Yeah, absolutely.
And use those patient assessment tools. And I'm sure there's some of those as information about
Yeah,
that
they're all
on the
listed on the
website.
CAM website.
It's really useful to use them, and they have been validated. It takes a little bit of time, but all of you, clearly you wouldn't be listening here tonight if you weren't interested. And so I think following those, using those patient assessment tools. And interestingly, people have done studies, and actually sometimes a better time to tell whether a treatment is working, like one of these supplemental things, is when you stop doing it rather than when you start doing it. So treatment withdrawal and seeing if there's a worsening of the signs is I think being shown to be more reliable with owners than when you start treatment, because when you start treatment, again, you're in that positive, I'm doing something mentality.
Yeah,
like buying the expensive makeup.
Yeah, so there you go. Well, it's been an absolute pleasure chatting to Kevin, and there's been so many comments saying how much people appreciate your honesty.
That's right. I apologize. Like I say, I often owners leave these consults, and I just sit there almost a bit deflated, thinking, have I just depressed them and confused them? And it would be so much easier if they came in and I just said, "Yep, your dog's got elbow dysplasia. I'm going to do arthroscopy tomorrow, and I will remove the fragment, and then the dog will come home and it'll be better, and it'll get arthritis later in life, and you can give it painkillers for that." It would be so much easier.
Yeah.
Or rather than me saying, well, we could do this, we could do that. You need to decide. I don't know, but I don't know it's misleading people. I don't like giving treatments on things that I wouldn't do for my own pet.
Yeah, no, absolutely. Yeah,
and that's what I always think first. And I do have a dog. I'm not saying my own pet, and I don't have a dog. My dog has sometimes I think, should I be doing that for my pet?
I think we always think about that for our pet, because I lost my old dog a year ago now, but I was always doing that. Should I do this? Should I not? It's sometimes the curse of knowing too much information, having access to people who know too much information.
And we all have slightly different opinions, without doubt. I work with someone who does probably twice the amount of arthroscopies that I do, and does quite a lot of pulls and thinks they're great, and maybe he's better than me at doing them, or maybe the way we assess the outcome is slightly different, or maybe I give conservative treatment a bit longer to work, or use physios more, so maybe my conservative treatment works better than his, and his surgery work. Who knows? Who knows?
Yeah. Oh, well, thank you so much. I'm just going to put in the animal care. So just want to say thank you again to Animal Care for sponsoring tonight's live. His CAM is volunteer-led. And thank you so much to Kevin as well for giving us an evening of your time, and such a lovely, honest approach to elbows and osteoarthritis, and just how complicated they can be.
Yeah. Like I say, I'd rather talk about hip replacements. Work very well.
We'll have you back, and we'll talk about it next time. Bye, CAM followers.